Hello, my name is Ignacio Esteban Gorgojo. I'm a junior member representative of the Immunotherapy Interest Group. Here I have the great pleasure today to introduce you to Dr. Pitsios, a member of the board of the Immunotherapy Interest Group. Hello, Dr. Pitsios.
Hi, Ignacio.
And we're here today to talk about the position paper of the Immunotherapy Interest Group about immunotherapy contraindications. Were there any guidelines there? What's new about the paper?
Of course, there were national and international guidelines that were always mentioning contraindications. However, they were different to each other. What we tried was to evaluate the published evidence and to create a new position paper on contraindications in order to clarify some controversies.
And in the paper you mentioned there are relative and absolute contraindications. Which will be the difference between them?
Well, it's clear what an absolute contraindication stands for. But if immunotherapy is a potential risk for the worsening of a concomitant disease or a condition, but the expected benefit from it outweighs the risk, then this is a relative contraindication.
And are there any new contraindications in the paper?
I would say that we have less contraindications now. For example, former anaphylactic episode due to immunotherapy, elder ages, the use of beta blockers for venom immunotherapy or ACE inhibitors for airborne allergen immunotherapy are not considered contraindications.
And are there any absolute contraindications that we should take care about?
Yes, some of them are ages under 2 years old, starting immunotherapy during pregnancy, the age stages of HIV infections, that is completely different from the initial stages of HIV infection. And of course, neoplasias are some of the absolute contraindications.
And what about asthma? It's a thing that always concerns us.
Well, we should never treat a patient that has an uncontrolled asthma because it's a high risk. So uncontrolled severe asthma is an absolute contraindication.
I think it was a really interesting interview. So thank you, Mr. Pitsios.
Thank you.
And I hope it was useful for all of you. Bye.
Bye.